Hello. Today I would like to teach you about the diabetes, how to take your blood glucose level.
Yeah. Yeah.
So first of all, do you know what is diabetes is?
Is it abnormal, like abnormally high or abnormally low sugar levels in the blood? Is that like a condition wherein your body is not able to regulate the sugar in your body as well as it should be?
Yes, that's correct.
Yeah? Okay, cool.
So you know what is the organ that diabetes would gonna affect your organ? So, you know.
Is it your liver?
No, it's your
pancreas.
Yeah.
Your pancreas, yeah.
That's fine.
Okay.
So the important function of
Sorry.
pancreas is making hormone. It try to regulate your blood glucose level.
Yeah.
So after a meal, your glucose level will transfer into your bloodstream and gonna release by the capillary into your pancreas tissue. So do you know what is the main destination that insulin gonna go after reaching your bloodstream?
Not sure. Can you refresh me on that?
The insulin travel into your bloodstream and get into your fat tissue, your muscle, and your liver tissue.
Yeah.
Yep. And the other question what I want to ask you is, do you know how is the differences between type 1 diabetes and type 2 diabetes?
Type 1 is, part of it is genetics, like you can get it early when you're younger, and it's like when your body is unable to produce, insulin, unable to produce enough insulin to help you or something like that.
Yeah.
Enough insulin to regulate the sugar in your blood. And then type 2 is more of like lifestyle related, and it's a later onset.
Wait. Is it this one recorded?
Yeah.
I don't. Oh yeah.
You have to do it again now.
Yeah, do it. That's fine.
Okay. Yeah. So type 2 is more of like later onset, and then it's more of lifestyle related. And then type 2 is like you're not insulin dependent.
Yes, correct. So I will explain it in more detail.
Yeah.
Type 1 diabetes is the destruction of the beta cell,
Okay, yes.
which is known as the islet of the Langerhans
Yeah.
in the pancreas. This is due to the immunological defect. And the type 2 diabetes is the inadequate insulin production or the insensitivity of the insulin production in your body. And so you know what is the treatment for the type 1 and type 2 diabetes?
Type 1 is usually you have insulin, like insulin injections. There's one treatment for type 1.
There's some sort of treatment here is like the fasting insulin, intermediate insulin, and the long and fasting and the long and short acting insulin altogether.
And then type 2 is like medication, like metformin, something like that.
Yeah, correct. It's the hypoglycemic medication, or you can use the injection insulin in your skin, your abdomen, and your thigh, your arm, and by subcutaneous insulin. And you can do diet. You can change your lifestyle, so it's diet and do more exercise activity. So you know what is the normal range of the blood glucose level?
It's 4 to 8.
Yes, correct. So what is considered as a low reading of the blood glucose level?
4 below?
Yeah, low.
4 and below?
Yeah. So what is the lower reading for the?
3 and below.
No, it's less than 4.
Oh, less than 4.
Yeah, less than 4 millimole per
millimils.
mole.
Okay,
Per mole,
with the unit.
Yeah, and how is the higher reading?
8 millimoles.
Yeah,
per
more
liter.
than yeah.
Yeah.
So in emergency case, if the patient conscious and able to swallow, so if they got the like low blood glucose level, what are you gonna do?
If they're not able to swallow.
Are able to swallow.
Are able to swallow.
And conscious.
And conscious. You can give them like orange juice or like a cordial, like sweet cordial with sugar in it, not the sugar-free ones. Or you can give them some biscuits, a sandwich to increase the blood sugar.
So what else is like more practical in the hospital setting?
You can give them the carbo test.
Carbo test.
Yeah.
Yeah, that's correct. But actually, you can use the jelly bean.
Oh yeah, the jelly bean. Yes.
Yeah, that's right.
Yeah, you can use that too.
But you only can use the carbo test in case they're unable to swallow and unconscious.
Oh, okay. Yes.
Yeah, and also, yeah. Anything else that you know? If they are unable to swallow and they are not conscious.
That's all I can remember at the for now. The jelly beans, the sandwiches, like the cordials with the sugar.
Okay. So
Is there anything else?
So if the patient is unconscious and unable to swallow, you should be able to provide
unconscious.
them. Yeah. Do you know?
You can. What's that? Glucagon?
Yeah, glucagon.
Yeah, glucagon.
Correct.
Yeah.
And anything else you can do? It's like emergency.
Emergency. That's
It's
all I can remember. I know glucagon. You can use glucagon.
Yeah, correct. It's very easy. It's like very normal stuff.
Carbo test? No.
Yeah,
carbo test.
And one more, the last step you need to do in emergency situation.
IV? No.
You need to call the med team.
Oh yeah, call the med team. Yes. I'll remember that. At least I can remember that next time. Yeah.
Oh, okay. So I'm gonna ask you some questions. So you know what is the reason that we have the high blood glucose level?
The reason why your body's not able to produce enough insulin to keep your sugar levels down. Is that the reason?
No, it's not a reason. It's just like three other like primary factors that are going to affect your high blood glucose.
So what was the question?
Yeah. So what are the primary factors? Like there are three primary main factors that affect your high blood glucose level.
I'm not sure.
No, it's not the reason. It's like a factors. It's like external factors.
Risk factors.
Yeah, risk factors.
Obesity. Is that what you're asking?
Yes, correct.
Obesity, like unhealthy like lifestyle.
Yeah, correct.
And like genetics, like if family history, like your parents have diabetes, doesn't that make you like predisposed? Like if your
no, it's
father,
not. Diabetes is not genetic condition. It's not really predisposed.
Oh, because I heard that if your father is diabetic or if one of your parents are diabetic, there's a 50% chance that you could be diabetic as well.
But it's not like a significant factor.
Oh, okay. So
yeah,
it's obesity, unhealthy lifestyle, and what's the third one?
So what will happen if the patient like is overweight?
Yes. Their body produces a lot more insulin because your body produces insulin that is equal to the amount of fat in your body. So if the more subcutaneous fat you have, the more insulin. Yeah. And then like your body can become resistant to the insulin.
Yeah, correct. Because insulin, because your body is insulin resistant, so your body can't actually clear the sugar. Yeah. Yeah, correct. And do you know what is the medical doctor going to do in that situation?
Not sure.
So they some sort of give the patient a drug to like a pumping of the insulin to a high level, which is 5 millimole.
5 millimoles.
Yeah, it's the ideal range of the insulin level. Yeah. So how about the lifestyle?
Healthy, balanced diet, and not too much processed foods, not too much sugar, not too much, I guess, some healthy moderation of foods.
And so what will happen if you consume too much carbohydrate?
Carbohydrates, yes.
What will happen if you consume too much food that has carbohydrate?
Increase in blood sugar levels.
So why is it increase your blood glucose level?
The carbohydrates.
Yeah.
I don't know. What's your answer?
Because you didn't do like activity like exercise,
yeah.
so that the reason if you're inactive, so the chance that you increase your blood glucose level, increase your cholesterol and triglyceride.
Triglycerides.
Yeah.
Yeah.
And so and you know any factors?
No.
Yeah, stress.
Okay, stress. Yeah.
So actually, if you are under stress and your body did not adapt to that stress, your body gonna go like your adrenal gland in your body gonna produce the cortisol. You know the cortisol.
Cortisol. Yeah.
Yeah, the cortisol is mean block the insulin receptors, and it causes your liver to produce more glucose in your bloodstream.
Yeah.
Yes, any more questions to ask me?
No, are you teaching me DBGL? Is that
Yeah, so
okay. Yep.
after this I'm going to introduce you about the steps to how to take the blood glucose level of the patient.
Yeah.
So you know the first step that the nurse needs to do before doing the BGL.
You need to prepare all your things and to introduce yourself to the patient and explain.
No, the first step when you walk into the room.
Oh, hand hygiene.
Yeah, correct. And then prepare the equipment,
Yeah.
explain the procedure to the patient, and after that?
So get all your equipment ready.
Yeah. Yeah. Next step.
And then next step. I don't know. Can you refresh? Remember?
Put on glove.
Yeah, put on glove
Yeah.
and then put the electrode into the machine.
Not yet. It's not yet.
Prepare all your things.
Yeah, correct. But next step after putting on your glove on.
After putting your gloves on, I don't know where.
Okay, I'm gonna remind you.
Yeah, that would be good.
So you need to wash the patient hands.
Yeah.
So what are you gonna do? Wash the patient hand with?
It's either you can use alcohol or you can use water.
Yeah, correct. You can use like a warm water or soap water.
Yep, soap water.
In case if you don't have the warm water or soap, you can use alcohol pad. Yeah. And so after that, what you gonna do after you wash it?
You get the needle.
Not yet.
Oh.
You can't leave it so wet.
Oh, yeah, you have to dry it.
Yeah. So what is the purpose to dry?
So you can get accurate results.
Yeah, correct. So after that,
you put the electrode into the machine and then you get the needle, the lancet.
Yeah, the lancet needles.
Yeah, and then you get one of the smaller fingers and then you prick on the side.
So what is the fingers you're gonna tap on the
either the middle finger or the ring finger.
So what the reason you can't
Because they're one of the less dominant fingers, and then also and then this not very callous as well, like because I guess if you're doing a lot of work and on the dominant hands you get a lot of callus, and then it's harder for the lancet to come through.
Okay. So you know what is the position that you're gonna
on the side?
poke your fingers? Yeah.
It's on the side.
So what is the purpose of doing that?
Because there's less pain receptors on the sides of your fingers.
Anything else?
Not.
So
don't remember anything else.
Because you can't actually poke the finger with the lancet on the middle of the finger or the nail of the finger.
Yeah.
You only do on the side of the finger because it's the most the capillary refill.
Okay.
Yeah.
Yes.
And after that.
After the capillary refill, oh wait, sorry. After you so where we up to? We fill the lancet.
Yes,
you pierce.
You poke your finger into the lancet.
And then make sure that their hands are facing downwards, and then you collect the blood through the small pit in the electrode, and then get blood, and then enough blood.
So, yeah, but what to happen if it's like your finger doesn't have insufficient?
Actually, what you can do before you pierce the finger with the lancet is that you can do a bit of massage and just make sure there's blood, the blood
to increase
flow.
The blood flow.
Circulation. And then you pierce the lancet, and that's how you can lessen the chance of not getting enough. But then I guess some patients are really hard to get blood off, even if after that massage. So I guess you can squeeze.
So you need to like push it firmly, harder. So
I guess you can.
So what's your question?
Oh, no question. What's next?
Okay. After that, the next step.
You put cotton balls and apply pressure, and then you wait for the.
No. So what you need to do first with the machine? You need to operate the machine before it works.
Yeah, but assuming that when you put the electrode, you've already turned it on.
Yeah. So what you're gonna do? The first step you're gonna do the machine.
Turn it on. Yeah. Put the electrode in. I already said that though.
No. So what is
I'll make sure that all, like when it turns on, it has all the 8s. Is that right? All the 8s, and then it's all working, and then it's ready. Like it has that like sign or icon on the machine that it's ready.
Yes, correct. So you know about the quality control.
Yeah. So you do that before.
So why you need to perform the quality control?
I'll just make sure you have accurate. Your machine is able to give you accurate results.
Yeah, it's not going to give you the faulty reading. Yeah. And so how often do we perform the quality control in the
quality control is every day, once a day.
Every day, once a day. So
but calibration.
Yeah,
because the quality control is once a day, but the calibration is when you open the new packet.
Yeah, but how long and how often you're gonna do it? Like one shift in the morning or night shift?
It depends. Usually night shift would, like, it makes sense. Night shift would do that, but sometimes it depends on the ward. Like for example, if it's day surgery, then obviously they do it in the morning. Well, that's where my placement is. They do it in the morning. They don't do it because they don't have night shift. So, but at least I guess you get to do it once a day.
Okay. Normally, because according to the South Australian Health, they said to me that every 4 to 6 hours.
Oh, okay.
So are we gonna checking the blood glucose level before or after meals? Do you think?
Before. It's good to check before. To find out reading, like how much your blood glucose is before you eat, and then I know that you take it before you perform a BGR before meals.
Okay. And after that, you're gonna inject the insulin into the patient with meal or without meal, do you think?
Sometimes it depends on the type of insulin.
So what do you mean, depending on the type of insulin for the patient?
There are some that you have to give before meals. I think there's a.
No, you have to, because the patient have to eat, and mix with the meals. After that, you're gonna give the insulin. Yeah, you're gonna increase the blood glucose level. Yep. So what is if the patient insulin is too high, like to 15 to 21 millimole, what you are gonna do?
It gives them insulin.
Yeah, but what type of insulin,
No.
You're gonna like the short-acting insulin, the one. Yeah. If the insulin level is from 15 to 21.
Okay.
Short-acting. Yeah.
Sure.
Hey guys, sorry, keep going.
Yeah.
I just need to use this real quick.
So after that, what I'm gonna do?
I don't know.
You're gonna operate the machine. Choose the finger to obtain the blood sample. So after that, what do you do?
Once you get the sample,
Yeah.
well, you put cotton ball. Well,
Yeah, cotton ball.
I don't know. You get rid of the sharps first, and then you put cotton ball, and then apply pressure, make sure that bleeding stops, and then you wait for result.
Okay. Wait for result. So what are you gonna do after that then?
Record it, document.
Yep. So what are you gonna assess the patient?
Yep. Monitor him later again.
Okay.
Is that right?
Yeah, correct. So after you document with the patient about him or her result, so after that, what you're gonna do? If the patient is dangerous,
Is
high
in
level
danger, then you do an intervention, I guess.
intervention.
You perform an intervention, or give him herbal test, or glucagon, or give him some sandwich, or something.
Okay. If
Or-
you're not sure what you're gonna do.
We'll just ask and ring the bell, I guess, if you're not sure. Or call the med team.
Okay. Maybe
Is
you
low?
should refer the doctor, diabetic educators.
Yep.
Yeah. So. Yes, so-
Anything else?
thanks.
Alright, okay, cool.
So we are gonna perform it.
Yeah. Yep, so hand hygiene first.
Hand hygiene. Yeah, hand hygiene first.
Yeah.
Do it. And
Gloves
after
on
that?
the other side.
Hmm?
Gloves on the other side.
Okay, I'm gonna get them.
Oh, can you grab one for me as well?
Okay.
Just
Which side are you?
small. Yep.
Oh, I'm gonna do it. Oh, I'm gonna show you.
Yeah.
Okay.
So I'll watch you first.
Okay. So hello, I'm Luke. I'm a first year nursing student. Today I would like to perform your blood glucose level.
Yep.
So would you be happy for me to
Yeah.
do it?
Yeah, sure, no worries.
Yeah. Sure. Which finger would you?
Any finger. Any
Okay.
finger. You can use any finger.
So I'm gonna introduce you the equipment first. So this one, the lancet with the needles,
Yep.
with the cotton ball.
Yep.
This one, the test strip.
Yep.
This one, the alcohol wipe. This one, the glucometer. So first of all, I'm gonna wash your hand and
Yeah.
dry off your hand with the tissue. This is tissue.
Yeah, tissue. Yep. And warm soap.
One shot. Yep. So which side of your finger?
This one. You can use this one. Did you want to prepare the machine?
Yep. And head to.
Put the electrode.
So what the first thing to obtain the correct result with the machine, you reckon? You need to.
Turn it on.
Yeah, and after that you need to like calibrate it.
No, but if you've done that, you usually don't do it before, like you do at the beginning of the shift.
Yeah, beginning of the shift,
Yeah.
you need to calibrate. So
Yeah.
what the reason to calibrate
No,
the machine?
Yeah. You use the. I think there's a solution.
Solution. So what you're gonna do with the quality control solution?
Yeah. Well, okay. Well, assuming that we finish the quality control,
Yeah.
like what do you do next?
So we're gonna do calibrate the machine. So
Yeah.
we're gonna do to make sure the test strip on the expiration date
Yep.
gonna you see the number here. So it's gonna be match with the correct code into the machine with the correct
Oh
test
yeah,
strip.
when you open. Yeah. Okay. So assuming that we've done that, so what do we do? Like just.
So gonna open the test head down.
Yep. And.
Put it in first. Is it this side?
Yep.
Yeah. So we need to
Is it
calibrate it.
No, you don't have to calibrate it anymore.
Oh no, we did check the correct map here with the correct on test strip.
Yep.
So where is it now? I can't see it.
Behind, I think. Is it?
I can't see it.
Or is it that one?
Yeah, that one. Where's the number?
No, that's the expiry.
Yeah, but where's the number?
6468. What is it numbers?
Yeah, 64.
64886. Why is that not there?
Yeah, just assuming that is.
That's the right one.
Yeah,
yep.
64886. Okay.
Yep.
So
okay.
I'm gonna put your this side.
Just you can do that. Yep.
So I'm gonna put here. Can you squeeze it to get more blood? And then you press it again.
No, you have to put it on this side. See that thing there? See that? That when it beeps, can you
Into the cotton ball.
Yep. Apply pressure.
Yeah, blood pressure.
Oh, you need a sharps container.
It's pretending. So I'm gonna.
Oh, sharps over there.
Yeah, so I'm gonna put the sharp container.
You should put that in the sharps container.
Yep. So the blood glucose level is 6.6.
Yep.
So what's the result? Can you tell me what the
It's a
result?
normal result.
Yep. So what the next step we're gonna do?
You're gonna have to get rid of this. You have to put it away, throw it, get rid, and then hand hygiene and document.
Yep, sure. Yep. And put in the shop container.
Yep.
Yep, here you turn to it. So you want to do it or not?
Yes. Okay. So I'll demonstrate now.
Yep.
Yeah. Okay. Do you have
The band-aid?
yeah. Oh, that's right. I'll get a band-aid later. That's fine. I'll just throw it. Yeah. So when I come into the room, I perform hand hygiene, and then perform hand hygiene, and introduce myself to the patient.
Yeah.
Hi, my name is Christy. I'm the student nurse, and I need to perform a blood glucose level just to check your blood sugar levels. Is that okay?
Yes, sure.
Yes, I'll check it before you have your dinner. So I'll first, since I've done the hand hygiene, put my gloves on. It's a bit hard with the wet. Yep. Okay, and then, well, assuming that I've done the calibration and everything,
Yep.
I'm going to get all my things ready. So I need an electrode, I need a lancet, and I need a what's that? Alcohol wipes.
Yep.
What I'll do is let's get some water with soap.
Yep.
Yeah. So assuming this stuff has soap on it. So got everything ready. So, okay. I'm gonna insert this into the electrode first. Yep, so that's ready. Okay. keep that on for now. I guess I can modify this a bit so I can. Oh, sorry. Any finger you'd like me? This one, or maybe this one. I'll take this one. Is that alright? Alright.
I'm scared.
Oh, that's okay. It'll be quick. It'll be quick. Yep. And then after that, I'll dry it a little bit, alcohol, and then do water. Just take any like sugar out or something. Yep. And then dry.
Yep.
Yep. Try it. And take this out. And then I take this off, isn't it?
Yes.
Yep. And I'll pop that in there. Okay. So it'll be quick. I'll massage a bit. Not too cold. So that's fine. Okay, and yep, if you can just like that for me, thank you. Yep, and that's beeping. I'll get you a band-aid after, and just
sure.
apply pressure on that just to stop the bleeding.
Okay.
Yeah. And then get rid of this in the sharps container.
Yes.
Yep, just grab that. Just 3 more seconds left.
So what's my result? Is 6.2. Is totally
Yes,
normal.
Yep, 6.2, so that's a normal reading. Let's wash my hands and get rid of everything. And document
Yep.
the time and the reading.
Yep.
Yep, and if it's low, then I do an intervention. Or
Okay.
call the med team if I have to.
Okay, sure.
So is that okay?
Yep.
And I'll get rid of this too.
Okay. So thank you for coming to my section today.
Yeah, thank you, Luke. Thanks.
Yep.